Well, thank you. I would like to thank everyone for joining us here today for an important conversation about the future of Medicare and Social Security in our country. My name is Wade Kapszukiewicz. I'm the Lucas County Treasurer, but my role here today is a member of the statewide Barack Obama Truth Team, and also, and I think this is relevant, before I was County Treasurer, I was a member of Toledo City Council, and one of the programs I created was the Northwest Ohio Pharmacy Card Network. And that program helped seniors in our community get prescription drugs at lower than what they would have on the open market. And that program had a lot of interaction with Medicare. So even though I myself am not a Medicare recipient, I think that experience allows me to be rightly frightened at what I'm hearing from Paul Ryan and his plans to destroy Medicare as we know it. We're here today to discuss what Mitt Romney and Paul Ryan's plan for our country would mean for the middle class in Ohio and all across our country. In naming Congressman Paul Ryan as his running mate, Mitt Romney has chosen a leader of the House Republicans who shares this very same flawed economic theory. It's a theory that says that you can somehow give the wealthiest citizens in our country budget-busting tax breaks and apply an even greater burden on the middle class, and somehow that's going to deliver a stronger economy as a result. That would be one thing if it was a theory and it needed to be tested out, but we've already done this. We've already tried that same failed trickle-down plan, and it just doesn't work. That's what we had for the first 10 years of the 2000s under George Bush. That was exactly the ideology that they pushed, tax breaks for the super wealthy and tax increases for the middle class. And what did it get us? It got us the worst economic recession and economic downturn since the Great Depression. So we know it doesn't work. We don't have to guess. It's not a theory. We know it doesn't work. And yet by picking Paul Ryan, Mitt Romney has embraced that same failed ideology. Now, Mitt Romney is very classically someone who doesn't necessarily have very many strong core values. We know that he used to support gun control, now he's against it. We know that he used to be pro-choice, now he's pro-life. He used to like government programs, now he says that they're terrible. He used to support gay marriage, now he's against it. I mean, he'll flip-flop depending on the whims of the day. Yet here again, he's tried to do the same thing. Even in picking Paul Ryan to be his running mate, he absurdly says that he doesn't necessarily support the Ryan budget plan. It's ridiculous on his face, but his own words betray him. Mitt Romney said that the Ryan budget was, quote, marvelous, and he said that if he were president of the United States, he would have signed it. Once again, he's trying to have it both ways, but people are too smart for that kind of silliness. The Romney-Ryan budget would give an additional $250,000 tax cut to millionaires. Middle-class families could pay thousands of dollars more a year in taxes to help pay for these tax breaks for millionaires. But today our special focus is to talk about Medicare and Social Security and what the Romney-Ryan plan would do to those programs. Paul Ryan authored the plan that would jeopardize the future well-being of our country's senior citizens by ending Medicare as we know it, and by privatizing Social Security, subjecting senior citizens' retirement security to the whims of the stock market. I can't imagine anyone thinks that's a good idea, and to help expound on that with personal experience, I'd like to turn it over to Marjorie.
Thank you so much, Wade, and thanks to everyone else for joining us today. For years, Ohio's seniors have paid into our country's safety net, our Medicare and Social Security programs, by working hard, playing by rules, and planning for the future. We are assured a safe and secure retirement. Today, 1.9 million Ohio seniors depend on our Medicare program. Medicare is my primary health insurance, and it has always served me well by allowing me to see my doctor without the hassle. It is convenient, and the transition to Medicare was extremely smooth. But with the choice of Paul Ryan, Mitt Romney's message for seniors is the same as his message was to Detroit: let them go bankrupt. Paul Ryan's radical plan for the country would end Medicare as we know it, making it unrecognizable by turning this critical program into a voucher system by which seniors and raising the eligibility age for Medicare recipients. According to the Congressional Budget Office, this kind of health care would increase costs for seniors by $6,350 a year. For seniors, this dramatic increase would be devastating. For those of us who are living on fixed incomes and already competing against other costs associated with age, an annual increase more than $6,000 is insurmountable. But it's not just Medicare that is at risk. It's Social Security as well. Ryan's plan would have allowed people under 55 to divert about half of their Social Security payroll taxes away from the traditional program and into private accounts. Yet his plan was so extreme that the Bush administration dialed it back, with a top aide to President Bush arguing that it was irresponsible for a plan that would borrow trillions to cover the transition costs to this plan. Today's seniors should be concerned, but who we are really worried about is our future generation, who would truly suffer from Romney-Ryan's implement their disastrous plans for our future. And as I say this, I turn it over to Kathy Jones. Thank you.
Thank you, Marjorie, and thank you everyone for being here. This weekend's announcement answered a lot of big questions about Mr. Romney's priorities, but it also raises a lot of important questions. For example, can our country really afford the extreme, out-of-touch, and severely conservative agenda that Mitt Romney and Paul Ryan are selling? My daughter receives Social Security and Medicare benefits due to a debilitating illness. She cannot afford the risk of having her benefits at the whim of financial markets. And it is just an outlandish idea to even think that she would be able to afford an additional $6,000 in health care costs. In addition to the devastating Romney-Ryan budget, this Republican pair is planning to repeal the Affordable Care Act, which is a law that I hold close to my heart. This law protects the seniors and people with disabilities from cutting wasteful spending in Medicare. Those savings improve the quality of care of all the recipients, as well as extending the solvency of Medicare for an additional 8 years, from 2016 to 2024. By repealing the Affordable Care Act, Mitt Romney and Paul Ryan would bring back massive overpayments to healthcare companies at the expense of the health of the program. As a result, Medicare could become insolvent in 2016. Lastly, by repealing the Affordable Care Act, Romney and Ryan bring back the Medicare donut hole, which costs thousands of seniors every day more expense in their prescription costs. Thank you for allowing me to speak, and now we'll take your questions.